When we hear the word patient, what comes to mind? Someone who is sick, someone with a disease. Welcome back to our Vibrant Life Project channel. In this video, we explore a powerful question: who is a patient? Inspired by the timeless wisdom of Dr. B.M. Hegde, is a celebrated physician, author, and thinker who believes that medicine is not just a science, but also an art rooted in humanity. In modern medicine, a patient is often reduced to a label. A person with diabetes becomes a diabetic. A person with asthma becomes an asthmatic. But a patient is never just a disease. A patient is a whole human being with a body, a mind, emotions, relationships, and a soul. When we forget this truth, we begin to treat the disease rather than the person. Every patient is unique. They have a personal story, a background, fears and hopes, different resilience. Two people may share the same diagnosis. Yet one lives with peace and balance, while another suffers with anxiety and despair. Biologically, they may look the same, but their human experience is entirely different. When we reduce people to patients, we strip away their individuality. Medicine becomes mechanical, healing becomes incomplete. Behind every disease, there is always a personal story. A back pain may carry the hidden weight of family struggles, emotional stress, or overwork. A headache may mask unspoken grief or inner turmoil. Doctors often miss the true cause and so the true healing. A patient deserves to be respected, listened to, and understood as a whole being. Yet in many hospitals, they are reduced to files, bed numbers, or medical reports. Illness does not define identity. They are fathers, mothers, children, dreamers, workers. If we say, "You are a strong human being who happens to have diabetes," the mindset shifts. They begin to see themselves as larger than their illness, and this very shift can fuel healing. The experience of being a patient is not only physical, it is also emotional. Fear, confusion, loneliness, these are as real as the physical symptoms. A person sitting in a doctor's office is often in a vulnerable state, worrying about survival, family, the future, or returning to normal life. If we see only the biological disease, we neglect their emotional suffering. A true healer must look beyond reports and scans. Compassion, listening, and reassurance are as essential as medicine or surgery. Illness often brings us face to face with the fragility of life and the uncertainty of tomorrow. Many turn to faith or inner strength during these moments. Healing requires attention to all dimensions: physical, emotional, social, and spiritual. Disease is never just biological. It is social, emotional, and relational. Culture, environment, personal values all shape the experience of illness. Treatment that works in one context may fail in another. Even diet depends on lifestyle, belief, and what can realistically be followed. When medicine becomes dehumanized, hospitals turn into factories. Doctors lose the art of listening, patients lose trust. True healing is partnership. The patient is not a passive recipient, but an active participant. Without their understanding, involvement, and cooperation, no treatment can be fully effective. Whether medication works often depends on how the patient embraces it, by adjusting lifestyle, managing stress, cultivating hope. Pills alone cannot cure chronic conditions. Healing requires lifestyle change, stress management, consistent follow-up, and above all, education. Patients must be educated, empowered, and encouraged to take charge of their health. They must be treated as intelligent partners in their healing. Trust is the foundation. Patients must trust their doctors. Doctors must trust their patients to take responsibility and communicate openly. Even the most difficult conditions can be managed with dignity and hope when there is partnership. After all, a patient knows their body better than anyone else. They feel the subtle changes, the side effects, the small shifts that no test can measure. That wisdom must be honored. A patient is not a disease. Behind every diagnosis is a human being, whole, unique, and deserving of dignity and compassion. Thank you for watching and being part of this journey. Share your thoughts in the comments, and don't forget to like and subscribe to stay connected.